Shall we start the class?
Yes, ma'am.
Rajalakshmi, you are from where?
Ma'am from Nayagarh.
From where?
Nayagarh.
Achha. What are you doing right now?
Ma'am housewife. दो बच्चे हैं.
Achha. Why you are interested to join this course?
मैम बच्चा थोड़ा बड़ा हो गया है ना इसी वजह से.
Lila Lalantika Devi,
Yes, ma'am.
you are from where?
Katak.
Cuttack. What are you doing?
Ma'am, nutrition counselor.
Where?
शिशु भवन, कटक शिशु भवन.
शिशु भवन.
Yes, ma'am.
कौन କରିଛନ୍ତି ନ୍ୟୁଟ୍ରିସନରେ?
I did my bachelor from OUT,
अच्छा. बीएससी
BSc.
होम साइंस. बीएससी होम साइंस.
Yes, ma'am.
Okay. Which year you are passed out from the OUT?
2014.
2000.
13.
And you joined in Sishu Bhavan in which year?
2013. Same year. 13.
2013. Okay, today I will discuss about the clinical therapeutic nutrition. Okay, our topic is clinical therapeutic nutrition. What is therapeutic nutrition? Rajlasmi. Leela madam, what is therapeutic nutrition?
Ma'am, it is nutrition for specific disease.
That is therapeutic nutrition. Therapeutic diet therapy. What is the meaning of diet therapy? Therapy means what?
To cure something. To
कौन
cure
कहते?
some.
ମୋ ଭଏସ୍ କ୍ଲିୟର ନୁହଁ ନା କ'ଣ କହୁଛନ୍ତି?
Yes, ma'am. Voice break होची.
What is therapeutic nutrition? What do you mean by diet therapy? Am I audible clearly now? Am I audible?
Yes, ma'am.
Okay. Diet therapy कहले हमें therapeutic diet means हमें कौन बुझीबा?
मैम किसी स्पेसिफिक डिजीज को प्रिवेंट करबा पई कि तारो ताको क्योर करबा पई जो डाइट एडॉप्ट करा जाए ताको डाइट थेरेपी कहजिबा.
Therapeutic diet means what? Therapeutic means what is the meaning of therapeutic? What do you mean by therapy? Tell me what do you mean by therapy first. Therapy is nothing. Therapy is the mode of treatment. Okay. Therapeutic diet means through diet how will we manage the different types of disorder. That is the therapeutic diet. Mode of treatment is the therapy. In the last class, I already discussed about the physiology. All of you are attending that class.
Yes, ma'am.
फिजियोलॉजी
Yes,
क्लास जो
ma'am.
मु करथिली लास्ट सेशन रे सबडा करे आपण माने थिले ना थिले नी
Yes, ma'am.
लीला मैडम आपण अटेंड करथिले ना नहीं
Yes, ma'am. मु दुईटा क्लास अटेंड करथिले दुईटा कर नथिले.
अच्छा आपण या पूर्व भुवनेश्वर गोटे थिले की हॉस्पिटल रे
ना.
अच्छा ओके therapeutic diet is the adaptation of the normal or the regular diet. Okay. And that is the modification of the normal or the regular diet that may be in the quantity level or the quality level to meet the altered nutritional requirement of the patient. That is the therapeutic diet. The diet may be modified for one or more of the following reasons. That may be depending upon the condition of the patient. And the modification can be both, maybe in the qualitative manner or in the quantitative manner. What is the qualitative adaptation? Qualitative adaptation of the diet. Qualitative adaptation of the diet, that means change in the consistency level. That is the qualitative adaptation. Consistency means what? First, first is the your normal diet or the regular diet. If we will change that normal diet in the qualitative level or otherwise in the quantitative adaptation, then that is called as the therapeutic diet. In the qualitative adaptation of the diet, mainly the changes in the consistency. That means that maybe the diet may be in the soft manner or the semi-solid nature, or that may be in the full fluid, clear fluid, or otherwise it may be in the oral or the tube feeding. And that modification is meal frequency to suit the altered structure and the function capacity of the organ and the gland also. It is called as the qualitative adaptation of the diet. In qualitative adaptation of the diet, mainly you have to change the diet in the consistency level. That is the qualitative adaptation. And the example of the qualitative adaptation of the diet is the that soft diet, otherwise semi-solid diet, or the full fluid diet, or clear liquid diet, or it may be oral or the tube feeding also. It comes under the qualitative adaptation. And what is the quantitative adaptation? Quantitative adaptation means you have to properly recommendation of the particular type of diet for the particular disorder. It is called as the quantitative adaptation. Understood what I am saying?
Yes, ma'am.
लीला मैडम बुझी होची ना?
Yes, ma'am.
So in the quantitative adaptation means if someone is affected by the nephrotic disorder, that may be affected by the CKD1, CKD2, or CKD3, or the case of the ESRT also, end stage of the renal disease, or if somebody will be affected by the hypertension, in that case now we are restricted some type of diet. That may that we are mostly we are restricted the sodium restricted diet. That diet is called as the quantitative adaptation of the diet. And in some cases also, like the nephrotic syndrome or the weight gain, or the those who are having the problem of the PEM, protein energy and the malnutrition, in that case we are mainly recommended the diet for the high energy and high protein diet, and that is called as the quantitative adaptation of the diet. In some cases, like if someone will be affected by the gout or any kind of arthritic disorder, in that case, what we are doing, we are mainly restricted the diet. Specifically, protein restriction is there, and that diet is called as that diet is mainly recommended for the weight reduction, and that is called as the quantitative adaptation of the diet. All of you clear about what is the quantitative and the qualitative adaptation of the diet?
Yes, ma'am.
Now I will discuss about
Yes,
the
ma'am.
health promotive or the effective therapeutic diets, and mainly generally prepared by the keeping the recommended dietary intake at the base. That means the amount of the nutrient mainly recommended for the healthy human beings can be used the standard on the benchmarks. Okay, and which the dietary intake of the patient can be computed. And adhering to the principle of the normal nutrition can help in the preventing the development of the toxicity or the deficiency during the treatment of the excess of the deficiency of the nutritional or the metabolic disorder. First, I will discuss about the medical nutrition therapy. A medical nutrition therapy is otherwise called as the MNT. Okay, MNT is your medical nutrition therapy, and why it is important, and the role of the dietitian in the healthcare profession, specifically dietetics, the science and art of the human nutrition care, and the role of dietitian in the healthcare system. In total, the nutrition care process means, what do you mean by nutrition care process? Nutrition care process is the combination of these things. In the nutrition care process, mainly it includes the nutritional assessment, nutritional diagnosis, nutritional intervention, nutritional monitoring, and the evaluation. Okay, all these things togetherly it is called as the nutritional care process. I want to ask something. Today is your first class now about the diet and therapeutic nutrition.
Yes, ma'am.
या पूर्व मुझे जहाँ क्लास नहीं वो तो फिजियोलॉजी ही क्लास नहीं आपण मानकर मास्टर डिग्री पिला मानकर
Yes, ma'am. Yes, ma'am.
एंड हाँ तापर आपण मानकर अच्छी बोधे बायोस्टैटिस्टिक्स रिसर्च मेथोडोलॉजी बोधे ना another paper अच्छी बोधे बायोस्टैटिस्टिक्स एंड रिसर्च मेथोडोलॉजी देखी ना सिलेबस किछि भी
अच्छी मैम अच्छी
बस बस मु पचारिबा कथा टुडे इज योर फर्स्ट क्लास अबाउट द थेरापेटिक न्यूट्रिशन
यस मैम
ओके
ma'am.
बिकॉज़ मु भाबुची ना मते एई गुडा किछि भी डीएनएच रे मु पढीतिली त मते लागुची काले मु तमानकर रिपीट करूची कि कोन सेति पे मु पचारुची टुडे इज योर फर्स्ट क्लास अबाउट द क्लिनिकल एंड थेरापेटिक न्यूट्रिशन ना
Yes, ma'am.
यस मैम
First class.
ओके बुझी होची मु जहा कहूची
यस मैम
Yes, ma'am.
and patient care and the counseling. The role of the main role of nutritionist is the to take care of the patient and the counseling to the patient. Okay. And the dietitian, mainly the dietetics, the science and art of the human nutritional care. And mainly dietetics has been defined as the science and art of the feeding individuals based on the principle of the nutrition. And the field of dietetics can be mainly related to the nutritional care and the intervention focused on the individuals, and the nutritional care and the intervention focused on the. And traditionally, the nutritionists mainly focused largely, almost fully on biological aspect of the nutrition. And the rapid growth of the scientific information and understanding the inexcredible natures of biological, sociological, psychological factors in the human life are now making it obvious that we need a holistic and the encompassing approach to human nutrition. And mainly this dietetic practice is mainly it depends upon the biochemistry, food, nutrition, management, and physiology, social science, and behavioral science. The factors affecting for the food choices. There are mainly three factors which is affect for the food choices. First one is your environmental factor, and the second one is your biological factors. Third one is your socio-cultural factor. All these three factors are mainly responsible for the affecting of the food choices. What is the environmental factor? In the environmental factor, mainly it depends upon the geographical climate and the seasons also, and the fuel availability, technology, transportation, and the economics. These all are comes under the environmental factors. And second one is your socio-cultural factors. In the socio-cultural factors, it mainly includes the education, understanding of the nutrition health concept, and traditional beliefs, the value, ideology, relation, communication, influence of the business, government, and policies, professional politics also. It comes under your socio-cultural factors. It also affecting the food choices. And in the last factors is your biological factors. The biological factors mainly it includes the nutritional needs and the hereditary factor also, and special physiological condition like during the pregnancy, or a special disorder means that the specific disease condition or any abnormal condition, and that also depends upon the taste preference of the patients or the individuals, and the craving, like and dislike. These all are the comes under your biological factors. These are the main three factors which are affecting your food choices. First one is the environmental factor, socio-cultural factor, and the biological factors.
Ma'am, one question is there.
Yes,
How heredity is a factors affecting food choices?
how? What is your question?
How heredity is a factor affecting food choices? How?
Heredity also the hereditary. If some cases you saw na during the counseling, you can observe that if some parents will be like or dislike for a particular diet, na the offspring also they are also not accepted that type of foods. This is also the one of the main reason for other biological factors. Normally, if you saw the some cases, if your mother will not like to take non-veg, na the offspring also not like to take that one. That's when the hereditary also plays a major role for the hereditary also play a major role for the food choices, the like and the dislike. This is also the one type of biological factors which are affecting the food choices. Are you got your answer?
Yes, ma'am.
What is medical nutrition therapy? Medical nutrition therapy is defined as the mainly it is the assessment of the nutritional status of the patient or any individuals, followed by the nutritional therapy, and that mainly ranging from the diet modification to specialized nutritional support such as the administration of enteral and the parental nutrition, and monitoring to evaluate the patient. It is called as the MNT or the medical nutrition therapy. These medical nutrition therapy also be defined as the nutritional diagnostic therapy, counseling services for the purpose of the management of each and every kind of acute, chronic and the fatal disorder. Okay. And these medical nutritional therapy mainly starts with the assessment of the nutritional status of the patient and the condition, illness or the injury. That also puts them a risk factor. And also it includes the review and the analysis of the medical and the diet history, laboratory investigation value, and the anthropometric measurement. And based on the assessment, the nutritional care plan may be most appropriate to manage the condition or to treat the illness or the injury is to formulated. And what is the chief role of a dietitian in the healthcare? Yes, Leela madam, because you are already working in the very good hospital. You are having the lots of experience now. Leela madam, are you there? What is the role of dietitian in the healthcare system? Mainly in the healthcare system, the dietitian is the link between the patient and the medical team or the physician and to assisting the difficult decision making about the nutritional care. Mainly a description of the dietitian role in terms of the managing the nutritional support of the terminally ill patient and maybe as follows. So the dietitian mainly needs to continue to play essential role in evaluation and decision making in the nutritional support of the terminal patient. And the development of the new feeding technologies, supplements and intervention also will continue to force difficult decision to made concerning the benefits of the modalities and the desire of the patients. What is the role of dietitian in the nutritional care? As per the ASPEN guidelines, it states that the Asian Society of the Parental and the Enteral Nutrition states that mainly the dietitian role in the nutritional care has been to recommend an adequate source and the amounts of balanced nutrient according to the pre-established standard of care. It's very important question for your exam point of view. What is the role of dietitian in the healthcare system? Okay. Rajalakshmi ma'am सुनुचंती ना कौन कही पूछी मो?
Yes, ma'am.
बहुत थर एटा एग्जाम रे आसी था ये क्वेश्चन. And ADA is your American Dietetic Association mainly remarked on the role of the dietitian in feeding. The dietitian, like the other healthcare professor, has an inherent ethical responsibility to respect the sanctity of life and the dignity and also rights of all the person and to provide the relief from the suffering. And main responsibility of the dietitian is to provide a combination of emotional supports and technical nutrition advice on how best to achieve the each patient goals within the legal parameters also. And the dietitian should be informed on the rights and desire of the patient and the family also. And it also the dietitian informed on the severity of illness and complication of the treatment, inclusive of the benefits and the burden of the feeding in all conceivable routes also. And the informed of the legal decision that may help determine the routes of care for the patient, such as more aggressive or the palliative care. And some of the situation may be arising during the practice of nutritional therapy, and that should be concern ethical decision in nutritional care, which they are the mainly difficulty of the adequate nutrition support of the malnourished patient, and benefits versus the burden question, especially in the terminal ill patient, and problems of the providing nourishment to complement patient who refuse the feeding also. And the role of the chief function of the dietitian is mainly the dietitian service focus upon the clinical service and the food service also, public health, the community nutrition, and nutrition information in the communication, and disease prevention also, wellness and the nutritional research. And specifically many dietitians are bringing to be involved in the newer specialty areas such as the wellness sports area also. They are working in the nutritional sector and cardiovascular fitness area also, nutritional education of the public, and the prenatal nutrition and physical medicine, that means in the PMR unit also. And all the dietitian are is helping the profession because the service they provide are the beneficial to the individual and for the society also, and they're mainly dedicated to improving the nutritional status of the people and helping the professional needs a variety of skills, that means mainly techniques of the interviewing, techniques of the counseling, and ability to relate to individuals, groups of the individuals also, and effectiveness in bringing about the changes, capacity for self-understanding, and knowledge of personality, group, and social dynamics also. And all the dietitian is a very important link in the chain of the patient care decision. Means that means consulting with the primary consultant or the physician, and implement a pragmatic moral judgment and action process, and confer with the other healthcare professional also. And the role of the dietitian and the medical team mainly rank the patient in accommodates to prompt need based on the following factors, mainly the present nutritional status. The dietitian present a nutritional assessment of the patient, and that may mainly includes the information specific to the ideal body weight and history of the weight loss, and pertinent laboratory investigation, and the anthropometric measurement also. History of the diet and the tube feeding tolerance. The dietitian mainly present the patient history, which may include the presence or history of the vomiting or the emesis, diarrhea, malabsorption syndrome, and the food allergic and lactose intolerance. These all are the primary factor. The chief role of the dietitian is to assist the people in planning their meals depending upon their age, sickness, or the work routine. And the dietitian mainly counsel individuals and the groups, organize the food service system in the hospital or the school areas, hostel, etc. And the dietitian and the nutritionist plan food and nutrition programs and supervise the preparation and the serving of the meals also. All the dietitian can be specialized in the several areas like the clinical sector, administration sector, and the research based also, community dietitian also. Mainly in the administrative dietitian, they play a major role in the large scale, and their meal planning and monitoring the food preparation, mainly processed by the applying the principle of the nutrition and the sound management in the hospital, schools, and the canteen. This is the role of administrative dietitian in the very large setup. In the clinical dietitian, those who are working as a clinical dietitian, they are sometimes called as the therapeutic dietitian. Clinical dietitian is otherwise called as the therapeutic dietitian because they are associated with the healthcare institute or the nursing home or in the hospital setup, and mainly depending on the nutritional needs of the patient on the basis of the individual nutritional assessment, They prepare the diet chart and monitor the results of the diet therapy also. They assess the patient nutritional needs, develop and implement nutritional care plans, evaluate and reports the results also. In the research dietitian, they are mainly working in the field of the normal and the therapeutic nutrition. And they are also research dietitian seeks ways to improve the nutrition of both health and the sick people. And they are mainly study nutrition science and education, food management, food service system, and the equipment, and how the body use the food. And the community dietitian is otherwise called as the nutritionist, and they may counsel the individuals in the group of sound nutrition practices to prevent the disease and maintain the good health also, and also rehabilitate the person recovering from the illness. This is the role of community dietitian or the nutritionist. What is the consultant dietitian? Consultant dietitian means they work under the contract with the healthcare facilities or in their own private practices, and they perform mainly nutrition screening for their client and offer advice on the diet related concern such as the weight loss or the cholesterol reduction, and some of for the wellness programs, sports teams, and the supermarket also. Academic dietitian means the teaching dietitian, and that dietitian process knowledge on the all aspect of nutrition and the dietitian. They constantly keep themselves updated in the necessary information and the knowledge which they transfer to the young interns or the trainers under the internship program. They are called as the academic dietitian. And what is the job role of the dietitian? Mainly, dietitian works with the people who have the special dietary needs, mainly inform the general public about the nutrition and give the unbiased advice, evaluate and improve the treatments, and educate the clients, doctors, nurses, healthcare professionals, and the community groups. And mainly, this dietitian can work in the variety of area. Many of they are in the hospital setup or in the community based, or they are in those who are belonging to the community based. They are called as the clinical dietitian, and the nutrition health educator or the manager. Both hospital and the community, the dietitian educate the people who needs the special diets as part of their medical treatment. What is NCP? I already discussed about that, the nutritional care process. Mainly, this nutritional care process is a very systemic and logical approach to ensure the effective and successful nutrition intervention. And the American Dietetic Association is the ADA defines the nutritional care process is a systemic problem, mainly solving the methods that defines the nutritional care process is a systemic problem solving method, and that dietetic professional used to critically think and make decisions to address the nutritional related problems and provides the safe and the effective quality nutrition care. That is the NCP, or it is otherwise called as the nutritional care process. In the relationship between the patient, client, and the group and the dietetic professional, mainly the relationship between the nutritional diagnosis. In the nutrition diagnosis, first you have to identify and label the problem, and after that you have to determine the cause, the etiology of the disorder, and the contributing the risk factors also, and cluster signs and symptoms of the different characteristic of that particular disorder, and you have to document all these things. What is nutritional intervention? In the nutritional intervention, you have to plan the nutritional intervention, formulate the goals and determine a plan of action also, and implement the nutritional intervention. Care is also delivered and the action are carried out by the documents. That is nutritional monitoring and the evaluation. Nutritional monitoring is the monitor process. That means how it will be progresses, measures the outcome of the indicators and evaluate the outcome. And finally, you have to document all these things. What is nutritional assessment? Nutritional assessments are obtained, collect timely and appropriate the data, analyze and interpret with the evidence-based standard document. Mainly, the nutritional care process is consisting of 4 distinct, and they all are interrelated and connected steps. One is the nutritional assessment, nutritional diagnosis, nutritional intervention, and nutritional monitoring and the evaluation. What is nutritional assessment? Leela madam kuhantu. What do you mean by nutritional assessment? Are you there? Am I audible to everyone?
Yes, ma'am.
All of you remain silent. That means what it indicates?
Yes, ma'am. Audible.
Yes, Rajalakshmi ma'am, you are saying something, but what about the others? Leela madam, are you there? Soumya Samikhya? Soumya Samikhya. Nutritional assessment कहले हमें कौन बुझिबा? Those who are working in the hospital in the regular basis, you are doing the nutritional assessment. What do you mean by nutritional assessment?
Ma'am, evidence the documents.
What type of documents? କିଛି ଜଣ ଅଛନ୍ତି କ୍ଲାସରେ ଅଛନ୍ତି ଆଉ ସେ ତାଙ୍କ ଦୁନିଆରେ ପୁରା. It's not that all of you are doing the master degree.
Ma'am, बोलते समय नाहंती लाइन रे.
ଆମେ କ୍ଲାସ ଏଟଲିଷ୍ଟ ମାନେ ଜଏନ୍ କରୁଛନ୍ତି ମାନେ ଆମେ ତ ଟିକେ ଶୁଣିବା ଏଣ୍ଡ ଇଣ୍ଟରାକ୍ସନ ହବା ନିହାତି ଦରକାର. ଅଦରୱାଇଜ ଇଫ୍ ଆଇ ୱିଲ୍ ବି ସେ କିଛି କିଛି ମୁଁ କହି ଚାଲୁଥିବି ଏଣ୍ଡ ଇଫ୍ ୟୁ ୱିଲ୍ ବି ନଟ୍ ରେସ୍ପଣ୍ଡ ଦେନ୍ କହିବାରେ କ'ଣ ଭ୍ୟାଲ୍ୟୁ ମୋର? ଛାଡ଼. What is nutritional assessment? Nutritional assessment is the evaluation of an individual nutritional status and the nutrient requirement. ଯେତେବେଳେ ଗୋଟେ ପେସେଣ୍ଟ ହସ୍ପିଟାଲାଇଜ ହେଇଥାଏ ଆମେ ରେଗୁଲାର ଇଣ୍ଟରଭାଲରେ ଆମେ ତାର ନ୍ୟୁଟ୍ରିସନାଲ ଆସେସମେଣ୍ଟ କରିବା ନିହାତି ଦରକାର. ବିକଜ ୱିଦାଉଟ୍ ନ୍ୟୁଟ୍ରିସନାଲ ଆସେସମେଣ୍ଟ ପେସେଣ୍ଟର କ'ଣ ପ୍ରୋଗ୍ରେସ ହେଇଛି ଆମେ କ'ଣ ଜାଣିବା? ଯେତେବେଳେ ପେସେଣ୍ଟ ଆଇସିୟୁରେ ଥାଏ ସେମି ଆଇସିୟୁରେ ଥାଏ ୟା ବେଡରେ ବି ଥାଏ ଯୋଉଠି ବି ଥାଉ ନା କାହିଁକି ମସଲ୍ସ ୱେଷ୍ଟିଂ ହଉଥାଏ. ଯେତେବେଳେ ପେସେଣ୍ଟର କଣ୍ଡିସନ ଡିଟୋରିଏଟ୍ କରି କରି ଯାଉଥାଏ ଦ୍ୟାଟ୍ ମିନ୍ସ ନ୍ୟୁଟ୍ରିସନ ପ୍ଲେ ଏ ମେଜର ରୋଲ୍ ଫର ଦ ରିକଭରି ଅଫ ଇଚ୍ ଆଣ୍ଡ ଏଭରି କାଇଣ୍ଡ ଅଫ ଡିସଅର୍ଡର. ଯଦି ଆମେ ସେ ସମୟରେ ଆମେ ନ୍ୟୁଟ୍ରିସନାଲ ଆସେସମେଣ୍ଟ ପ୍ରପରଲି ଆମେ କରିବାନି ଏଣ୍ଡ ଇଚ୍ 15 ଡେଜ୍ 8 ଡେଜ୍ ଇଣ୍ଟରଭାଲରେ ଯଦି କିଛି ପେସେଣ୍ଟ ପ୍ରୋଗ୍ରେସ ନ ହଉଥିବ ତାହେଲେ ତ ହୁଏତ ପେସେଣ୍ଟ ଡିଟୋରିଏଟ୍ କରି କରି ଯାଉଥିବ. ତ ଆମକୁ ସେଇଥିପାଇଁ ବୋଲି ନ୍ୟୁଟ୍ରିସନାଲ ଆସେସମେଣ୍ଟ କରିବା ନିହାତି ଦରକାର. ଏଣ୍ଡ ଦ ନ୍ୟୁଟ୍ରିସନାଲ ଫାଷ୍ଟ ଆମେ କ'ଣ କରିବା ଇଣ୍ଡିଭିଜୁଆଲର ନ୍ୟୁଟ୍ରିସନାଲ ଷ୍ଟାଟସକୁ ଆମେ ଦେଖିବା ଏଣ୍ଡ after that ଆମେ observe କରିବା patient କ'ଣ need ଅଛି and accordingly we will formulate the menu plan and accordingly we will formulate the diet plan and the which type of nutrient required for that particular type of disorder. And it is a very systemic process of obtaining, verifying and interpreting the data in order to make the decision about the nature and the cause of the nutrition related problem. That is the nutritional assessment. And what is the purpose of this nutritional assessment? It's a very important question for your exam point of view. Eta prior exam day mu dekhichi pray ase and those you are in future if you will be work in the any kind of hospital na it's very important, very vital for you, for all the nutritionists. Okay, and what is the purpose of this nutritional assessment? Kahinki ame koriba nutritional assessment? Because obtain the adequate information in order to identify the nutrition related problem and mainly it defines the accurately an individual nutritional status also. and it also determines the level of nutritional support that individual needs and monitor the changes in the nutritional status and the effect of the nutritional intervention. For that only, this nutritional assessment is very vital. And आमे जो nutritional assessment करिबा, this process is mainly refer माने आमे चारिटा जिनिस को प्रथमे आमे देखिबा. Specifically, this nutritional assessment is based on the interpretation of the information that obtained from the diet history, medical history, and your review of the symptoms, physical, clinical examination, including the anthropometric measurement and the laboratory investigation also. And जो न्यूट्रिशनल असेसमेंट आमे करिबा मेनली न्यूट्रिशनल असेसमेंट रो गोटे प्रोसेस थाए एंड दैट प्रोसेस इज रिफर्ड टू एज द एबीसीडी एनालिसिस. Nutritional assessment means you have to do the ABCD analysis. What is ABCD analysis? Very 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 important question for your exam point of view. Also it is सुनंतो. A stands for the anthropometric measurement. Anthropometric, what do you mean by anthropometric measurement? Anthropometric measurement means it measures the growth in the children and specifically shows the changes in the weight in the population, and that can reflect the disease. And it also help to monitor the progress in fat loss or the fat gain. Understood? It is the your anthropometric measure. It's the A. After that, what is B? B stands for the biochemical investigation. You remember bit by bit. B is refers for the biochemical investigation. What do you mean by biochemical investigation? Biochemical investigation means this helps to reveal the nutrient and the metabolites in the blood and the urine, and also faces also. That indicates an infection or the disease. You have to briefly evaluate the all the pathological investigation that may be from the blood, stools, and from the urine also. What do you mean by faces? Faces को लेमे कौन बुझिबा?
Waste material,
Very
body
good.
ro.
Body waste material. It is otherwise called as the very good. This is all about your biochemical investigation, and C refers to the clinical analysis. In the clinical analysis, you have to include a complete physical examination of the patient and the medical history also. The physical examination begins with the patient's general appearance, mainly nutrition-oriented aspect of the physical examination. Mainly, you have to focus on the skin, head, and hair also, eyes, mouth, nail, extremities, upper extremities and the lower extremities, abdomen, skeleton muscles, and the fat stores. And the clinical signs with their nutritional implication are very important also. What is D? D mainly refers, it indicates the diet history and the nutrient intake. What is diet history? That means it is mainly used to evaluate the diet for the nutrient or the food intake. That means common methods used include the 24-hour diet recall method, diet history, food frequency, questionnaires, weight main, method. These all are comes under the what? Your diet history and the nutrient intake. This is all about your nutritional assessment. You can assess the patient through the these four measurements by the anthropometric measurements and by the biochemical investigation and by the clinical analysis, and these starts for the diet history and the nutritional intake. This is all about your what? Nutritional assessment. बुझिएला ना बुझिएला नहीं?
Yes,
All
ma'am.
of you understood what I am saying?
Yes, ma'am.
I already discussed about the anthropometric measurement. Now I will discuss about the criteria for the assessing the degree of malnutrition. What is malnutrition? What do you mean by malnutrition? It's a very simple question. Malnutrition कहले हम कौन बुझिबा?
I'm undernourished or overnourished is malnutrition.
Very good, very good. That may be undernourished or that may be what?
Overnourished.
Overweight, maybe mild malnutrition, otherwise moderate malnutrition or severely malnutrition. Okay, it is called as the malnutrition. Mainly, what is BMI?
Body mass index.
What is body mass index? How will we calculate this BMI? Tell me. How we calculate the BMI? BMI will be calculated by the weight in kg. You remember in each and everywhere you will be. It's very important for the practical life. BMI means body mass index. What is body mass index? It can be calculated like this: weight in kg divided by height in meter square. That means आपनकर जदि बॉडी वेट अछि 162 सेंटीमीटर बुझियला ताहले हमें सेही थ्रू आपण -100 करिवे ताले केते आसुची 62 केजी जेति की आपनकर बॉडी वेट हाइट थिबो सेही थ्रू आपनकर -100 करिवे सेति की जदि आपनकर बॉडी वेट अछि देन आमे ताको कहिबा छी तार आइडियल बॉडी वेट ता बीएमआई पाखा पाखी प्राय नॉर्मल रेंज रे आसीबो से ओवरवेट हेई नथिबो कि अंडर वेट भी हेई नथिबो बुझियला हम कोन कहिले
Yes, ma'am.
okay now the body mass index mainly defines the level of adiposity according to the relationship of the weight to the height okay and it mainly eliminates the dependence on the frame size. And how will we calculate the body BMI? First, weight in kg divided by height in meter square. And the tricep skin fold measurements it is also very important during your nutritional assessment. What is this tricep skin fold measurement? Triceps means what? Triceps is our skin fold that muscles, okay? And through the triceps muscles is mainly measured with a caliper that measures the thickness of the skin fold over the triceps muscles of the arms and not in the predominant uses. And the triceps skin fold measurement for the female na we standard female ko jodi ame taku measurement kariba standard hoji 16.5 hoji for the female and for the male it is 12.5. That is your triceps skin fold measurement. Female mane ka normally rahibo apanako 16.5 and plus or minus 1 hele bi ame taku normal boli kahiba but in the male case it is 12.5 only. And what is MUSC? MUSC is your mid upper arm circumference. What is mid upper arm circumference? That mid upper arm circumference mainly measurement of the arm in is taken with a metric tape measured at the midpoint between the acromion bone. Acromion bone is the portion of the shoulder blade. Okay. And or the scapula. Scapula is present where? At the back side of your neck, one prominent bone is there in the lateral side of your spine and that is called as the scapula. Janchen the scapula kota?
Yes, ma'am.
Bas, say scapula. And that overhangs the rotator cuff and the humerus, the upper arm of the bone, and the olecranon process. That means olecranon bone is that the olecranon bone is the proximal part of the ulna. Amar jo radius ulna jo rahichi, प्रथमे तो ह्यूमरस रही हाथर बुझीगला देखिए दूसरी यहाँ दिशा जाऊथबो एटा तो हमर फर्स्ट अपर आर्म रे जोटा रही हमर एल्बो जॉइंट पर्यंत जोटा दैट इज द ह्यूमरस एंड जोटा बॉडी तापर हमर रेडियस एंड ऑल्ला इज प्रेजेंट इन आवर हैंड हाथ रे रही जोटा हमर टुवर्ड्स आवर बॉडी दैट इज योर ऑल्नार बोन्स and away from the body jota rahichi that is your radius. And what is the main physical signs indicative or the suggestive of the malnutrition? If someone will be affected by the malnutrition, na, and normally in the those who are having the malnutrition, the possible sign of the malnutrition is hair. Those who are having the malnourished, their hairs are normally normal appearance of the hair is the shiny, thin, and easily plucked. But if someone will be affected by the malnourished, then due to the kwashiorkor or the less common mainly in the marasmus also excessive bleaching of the hairs, that is alopecia is very common. Okay, alopecia is the medical term of the loss of hair. हमर जो चुट्टी झड़ीबा को मेडिकल टर्म रे हम देखो एलोपेसिया बोली कहताओ. एंड जो न्यूट्रिएंट डेफिसिटी ड्यू टू द डेफिसिटी ऑफ राइबोफ्लाविन हो किंबा some other nutrient deficit रो हमर जो specifically PEM protein energy malnutrition रे हमर कोन होची क्वासियोकर देखा जाउची. And due to that kwashiorkor, that normal appearance of the skin is called uniform skin color, and that skin should be very smooth, healthy appearance, and no facial swelling also there. But those who are having the kwashiorkor, na, they're swollen their face, means it looks like the what moon face. And if you will look at the face of that kwashiorkor patients, na, the paleness मुहरे गोटे गोटे सेता टाइप रे देखा जाउतबो. In labial seborrhea, that means scaling of the skin around the nostrils. अपन देखिबे तारो नाको साइड रो नाको ऊपर जे सब स्केल काटी छाडला बोले ताको देखा जाउतो due to the deficiency of your vitamins and minerals, specifically due to the deficiency of your B complex vitamins, and the riboflavin is the main cause of this disorder. And another malnourished is due to the what anemia is also the due to the deficiency of iron. And vitamin A ro deficit ro amar hochi corneal xerosis. Corneal xerosis is your what? Cornea means cornea, that white part of your eyes is called as the cornea. Due to the deficiency of vitamin A ro deficiency hava lagi, xerosis is the very common problem, and that's mainly seen in the corneal part. Cornea means eyes ro jo white part ta thae ताको cornea कहा जाए. And due to the vitamin A deficiency, that corneal part becomes very dry, that is called as the xerosis. Xerosis माने जदि आखि रो सी धला पार्ट जदि सुखा सुखा हे जाय विटामिन A deficiency रो ताको हमें कहिबा जे corneal xerosis. And due to the deficiency of vitamin A, so many complications arises in our eye. And the common symptoms of the eye disorder are your conjunctival xerosis, that is the dryness of your eye, and the corneal xerosis, dullness, and keratomalacia is also very common due to the deficiency of vitamin A, and whiter spots, pale conjunctiva. It is also the one of the cause of vitamin A deficiency. Whiter spots means कौन जितबले देखिथिबे केजन का आखि जदि हम देखिबा नॉर्मली आखि रे कोन प्रकार स्पॉट न थाए, but those who are having the vitamin A deficit ना, they are having the problem of the आखि आपण देखिबे आखि रे गोटे गोटे स्पॉट रो कळा कळा चिन्ह होई किथिबो due to the less intake of vitamin A. That is the main reason of these whiter spots. बुझी होची मजा कहूची ना बेसी स्पीडी होची, स्पीडी न होले मते माने बहुत कम क्लासेस अछि, से क्लासेस रे बुक पूरे सारी होनी, बहुत बड़ बड़ मोटा बही रही छी. कोन कहउचंते बुझी पारुचंती ना नाही मुझे हा पढौची. And another problem of the due to the vitamin deficiency, that is the riboflavin. Due to the riboflavin deficiency, another problem is arises, and it is called as the angular ciliosis. Angular ciliosis means white or pink lesion at the corners of the mouth. आपण मन देखिथिबे के जणको पाटी भितरे माने जुटा कळकिया तुंड गा बळे हे जे जुटा कि दळा दळा हो कि नाली नाली स्पॉट देखा जाय. In medical term of that disorder is called as the angular ciliosis, and it is occurred due to the deficiency of your riboflavin. Okay, and another problem is due to the deficiency of riboflavin, folic acid, and niacin. that is the magenta tongue. That means filiform papilla. Filiform papilla is present in our tongue, and that is the atrophy and hypertrophy occur. This is also occurred due to the deficiency of riboflavin. And in teeth also there is another problem, that is the fluorosis. Fluorosis means what?
मैम फ्लोराइड कंटेंट
हाँ केतेटा आपण देखिथिबे केतेटा एरिया रो माने जो पानी थाए सेथिरे आपनकर फ्लोराइड कंटेंट उडाको बहुत अधिक थाए बुझिला ड्यू टू दैट ओनली फ्लोरोसिस सेठी देखिथिबे से मानकर बहुत सारा डेंटल प्रॉब्लम पर्टिकुलरली गोटे डिसऑर्डर अछि ना हमें एरिया स्पेसिफिकली से एरिया को से डिसऑर्डर पेशेंट माने ज्यादा आसंती दैट इज कॉल्ड एज द फ्लोरोसिस ड्यू टू द अधिक जितल फ्लोराइड हे जाए वाटर रे सेठी फ्लोरोसिस मध्ये देखा जाए इट इज द mottled enamels caries many cavities, missing teeth is very common. Okay, and due to the deficiency of vitamin C, another problem is arises. It is called as the scurvy or spongy bleeding, receding gums. Gums आपनकर जो रही सेठी आपनकर bleeding होगा, that is due to the deficiency of vitamins what C, and due to the deficiency of iodine and the starvation bulimia, enlargement of the thyroid gland, that is the due to the what insufficient secretion of the iodine or the deficiency of the iron, it got the enlargement of the thyroid gland. Okay, and another problem is your kwashiorkor, thiamine and niacin. Due to the this kwashiorkor, thiamine and niacin, it's mainly occur due to the deficiency of this pure vitamin B12. Due to the deficiency of your vitamin B12, it mainly causes the psychological stability and also it's called the mental confusion. Mental confusion and sensory losses is also there. Motor weakness and loss of positional senses. Loss of vibration is also there. सुचिस्मिता तुम्हें कोठू भुवनेश्वर ना को जगह
मैम भुवनेश्वर
कौन करू छ अबे को हॉस्पिटल रे अटैच छ
मैम हॉस्पिटल नहीं मैम जॉब कुछ होई हुई थी कोई थी मैम
यू आर
कल जो भाई है
सुना जाउनी सुचिस्मिता बड़ा पटरे को
मैम कल जो भाईवा नहीं थे कोई ने होई हुई थी रोची लैब असिस्टेंट
ओ सुचिस्मिता तुम्हें कल अच्छा हां कल थिलो बोदे ना
आगे मैम आगे
आज कोन पे क्लास करलोनी पूरा आरंभ रो
मैम एबे ऑफिस वाला 5 पे तो सेति पे जॉइन कर मैम
ऑफिस रे भी तो क्लास रे जॉइन करि परिबो एटलीस्ट करि कि सुनी परिबो एमती न जे पूरा ऑफिस रे 8 घंटा पूरा एमती व्यस्त आमे भी तो क्लास करूची ना ऑफिस रे थाई कि भी
सॉरी मैम नेक्स्ट क्लास तो मैम चेक कर जॉइन करूंगी
सॉरी कहले कोन हबो तमे लॉस करूछ मु लॉस करूची कि हां क्लास न होले तमन को दरकार एकेडमिक काउंसलर क्लास थैंक यू होनी क्लास हेले तमन को समय नै काली मु कहिथिली ना तुमको तो लास्ट रे तमे थिला बोते ना
आगे मैम आगे
हां लास्ट रे थिलो कोन कहिथिली पढिबा पई बोते
आगे मैम
क्लास न कले पाठ केमति पढिबो इंटरेस्टिंग बने पढिबा पई नेक्स्ट क्लास ऑनवर्ड्स आउ तो बोते 8टा घंटे के केतना क्लास थिबो तमरो स्पेसिफिकली थेरापेटिक न्यूट्रिशन एंड तमे कहउतलो ना मैडम स्टैटिस्टिक्स रिसर्च मेथोडोलॉजी केमति कोन हबो ये हबो बुझियबो ना न तमे बोते पचरतलो से कथा
आगे मैम पचरतली मैम
क्लास न कले केमति हबो क्लास तो करिया को पड़िबो ओके
आगे मैम
This is all about your that nutritional deficiency and physical signs indicative or the suggestive of for the malnutrition. Okay. Now I will discuss about the nutritional diagnosis. What is nutritional diagnosis? Nutritional diagnosis is the identification and labeling that describes an actual occurrence, risks, or the potential for developing a nutritional program or nutritional dietetic professionals are responsible for treating the independently. That is the nutritional diagnosis. Nutritional diagnosis means you have to analyze the assessment data, and naming the nutritional diagnosis provides a link to setting realistic and the measurable expected outcome. I already discussed about the nutritional intervention, and I also discussed about the nutritional monitoring and evaluation. এইটু নিহাতি রূপে কোশ্চিন আসিপারে আপন মানଙ୍କର। What is nutritional intervention? Nutritional intervention means actual intake of the nutrient. Okay, actual intake of the nutrient minus desirable intake divided by desirable intake. That is your nutritional intake. What is documentation? Documentation is an essential aspect of the nutritional care process. Okay, and mainly this documentation, it helps the patient to understand the nutritional care plan and their role in this process also. Another important question is for your exam point of view, that is the SOAP. It's very important. समस्ते एटा भलो से सुनंतु जो जिनस मु पढेला बेल को बार रिपीटेडली कहूची सेही थ्रू निहाती रूपे एइदर 2 मार्क्स 4 मार्क्स या लॉन्ग क्वेश्चन रे मध्ये आसीते रिपीटेडली आसे एमती कोनोसी इयर नै जोथुर की न आसे। तो आपण माने तो मास्टर्स डिग्री एग्जाम देबे जोटा कहूची सेटा टिके मन देखि एटलीस्ट आपनक पाखरे समस्त माने मटेरियल्स अछि एबे
नो मैम।
पाइनांती
मैम मैट्रेस अच्छी मैम ऑफिस को मैम आनी नहीं
अच्छी तो बहुत भलो कथा मु जोटा एटलीस्ट इंपोर्टेंट कहूची ताको गोटे रफ रे कॉपी रे लेखि रखंतु एंड मु माने क्लास ओवर होला परी या नितोला आपण मन समय पाइबे नियात रूपे ताको ओवरलुक करंतु सेटा बहुत निहात इंपोर्टेंट। व्हाट इज एसओपी? SOP is the S refers to subjective, O is the objective, A is the assessment, and P is the plan. This is the SOAP. And various healthcare professionals like the physician, nurses, and dietitian, social workers routinely collected much of the information. And the entire team of the healthcare profession ensures that all the aspects of nutritional care are not in place as a part of the total healthcare records. And the SOAP mainly refers to the subjective. What is subjective? Subjective means the data including the information obtained from the patient or the patient's family regarding the problem. That is the subjective. जोटा कि हमें data mainly includes the information obtained from the direct from the patient or from the जो फैमिली टू हमें बड़े बड़े पेशेंट इज नॉट एबल टू स्पीक एवरीथिंग केते केते पेशेंट तो किछि जानि ही पारंतिनी तो सही केस रे हम कोन कोन सब्स्टिट्यूट हिसाब रे तांको फैमिली मेंबर्स टू भी हम किछि हिस्ट्री नो तो दैट इज योर सब्जेक्टिव। एंड सेकंड वन इज योर ऑब्जेक्टिव डाटा। ओ इज रेफर्स टू द ऑब्जेक्टिव डाटा। व्हाट इज ऑब्जेक्टिव डाटा? ऑब्जेक्टिव डाटा मींस द डाटा इज गेदर्ड फ्रॉम द टेस्ट। हम बहुत सारा जते बड़ा गोटे डिजीज रो हम फाइनलाइज गोटे डायग्नोसिस पर्यंत हम पहुंचू ना तो डिजीज रो हमें डायग्नोसिस पर्यंत पहुंचिया पे हमें बहुत सारा इन्वेस्टिगेशन प्रोसेसर हमें करो आफ्टर हमें सब तक फाइनलाइज हे सला पर हम गोटे डायग्नोसिस पहुंचू नहीं तको एई प्रकार डिसऑर्डर हेची का एई फाइंडिंग्स रो हमें एई नतीजा रे हमें पहुंच तो दैट इज कॉल्ड एज प्योर डायग्नोस्टिक। वी आर यूजिंग द डिफरेंट टाइप्स ऑफ टेस्ट एंड एनालिसिस आल्सो डायग्नोसिस प्रोसीजर आल्सो एंड द ऑब्जर्वेशन बाय द हेल्थ केयर टीम्स। दैट इज योर ऑब्जेक्टिव डाटा। जो जिनस हमें बायोलॉजिकल हो पैथोलॉजिकल हो किंबा आपनकर क्लिनिकली हो जहाँ जहाँ इन्वेस्टिगेशन हमें रिक्वायर करो फॉर द गोटे डायग्नोसिस रे पहुंचिया पई दैट इज कॉल्ड एज योर ऑब्जेक्टिव डाटा। एंड डाटा इज गेदर्ड फ्रॉम द टेस्ट एनालिसिस डायग्नोस्टिक प्रोसीजर and the observation by the healthcare team. That is your objective data. What is assessment? Assessment is the interpretation of the patient's status is based on the subjective and the objective data. It's mainly based on the subjective and the objective data. And what is P? P refers to the mainly specific plans are stated for the dealing with each problem, such as the specific treatment plans, nutritional care plans, and what you are recommended for the diet therapy, that is the your modified diet plan chart, and the nutritional counseling goals, etc. It is your plan. It's all about your SOAP. It's very important question for your exam point of view. All of you understood?
Yes, ma'am.
एनर्जी नहीं न्यूट्रिशनिस्ट माने जो यस और नो कहबा को एनर्जी नथिबो ताले की कहबो आ कहार क्लास रे तो मते लागु किछि माने इंटरेक्शन नथिबो बोते पूरे
No,
साइलेंट
yes.
हां
Yes, ma'am.
कोन दरकार चाहा ना कॉफी ना कोन बॉडी को स्टिमुलेट करिवा पे ये सुचिस्मिता काले तो बहुत जोर हसुतुला आज पड़े गला
मैम
बुझिएला एसओपी कोन
यस मैम
Another chief role of the dietitian is the patient care and the counseling. Okay, patient care is the very important, and in the patient care, the primary basis principle in the nutritional practice to be valid must be the person and the patient centered. It must be based on the initial and the continuing the identifying needs and updated the constantly with the patient in order to provide the essential physical care and support the personal needs for maintaining the self-esteem. And mainly the healthcare team is the process. As you already discussed about that, it mainly the healthcare professionals. It includes the physician and all the healthcare professionals, dietitian, nurses. And there are the five distinct, constantly interacting phase in the healthcare process, mainly assessing and analyzing, planning care, implementing care, and the evaluating and the recording care. These five things are very important. What is counseling? Counseling means the term counseling or the nutritional diet counseling is a very broader term, and mainly then the teaching. It is one of the most useful methods for the assisting an individual to arrive at a solution of his or her problems. Okay, and it is the personal meeting of two individuals, the counselor, who is counselor, who assists in analyzing and understanding the problems, and the counsel, who has problems and needs assistance in arriving at a solution for this problem. ଦି ଜଣ ଗୋଟେ ହେଉଛି କାଉନସିଲର ଗୋଟେ ଜଣେ ଆଉ ଗୋଟେ ହେଉଛି କାଉନସିଲି ଯାହାକୁ ଆମେ କାଉନସିଲିଂ କରିବା ସି ଇଜ ୟୋର କାଉନସିଲିଂ ଆପଣ ମାନେ କାଉନସିଲିଂ କରିବେ ୟୁ ଆର୍ ଦ କାଉନସିଲର. It has been described as the internal process of the counseling and mainly a sequence of events and the elements of the interpersonal relationship between counselor and the counselee. Mainly, the nutrition or the diet counseling is a very primary educational activity of the dietitian. It incorporates the idea of working with the patient and encouraging him to make changes in his pattern of living that he see a describe and attainable and supporting him throughout the process. And the main aims of the counseling is mainly to help the client makes and sustains desired changes over time, mainly based on the two premises. One is the each person control his own life and behavior, and second one is each individual also has a background of personal interaction, socialization, and the education that he or she used to make the choice about their behavior. And counseling also, counseling is a very explored as a fourth stage process. And the first step of the counseling is to mainly concentrate on the development of the trusting, helping the relationship between the counselor and the counselee. It's very vital. You remember this point, and it is also a very important question for your exam point of view. And the remaining three stages focus mainly, you have to focus on the during the counseling, your focus should be on the solving the problems, and the dietary counseling mainly it includes in its scope behavior modification, counseling and cognition, nutritional counseling, and the multicultural communication. During the counseling, you have to focus on these points. Mainly, you have to focus on the reinforcement of sound eating habit. Okay, while you are counseling to a patient or in the any kind of forum, you have to reinforcement of the sounds eating habit, and also explanation of various assessment and the treatment techniques also, and training in the various feeding techniques, and positive suggestion to the improve the poor habits, and also discussion of the reasons for the diet modification, and guidance in the practice in planning meals meeting specific diet modification. Also training in the various feeding techniques is also very important. And mainly the theories and the approaches relevant to the counseling, it's mainly few theories and approaches relevant to the counseling. One is your reality theory, and second thing is your behavior counseling. It's very vital during the counseling. This behavior counseling is evolved from the early theories of the behaviorism, and it's very important. And third one is your behavioral approaches. It is otherwise called as your cognitive counseling. And another one is your counseling strategy. Counseling strategy means mainly it's all useful for the different way, like the individual counseling. Individual counseling is the personal counseling, and the first step in this type of counseling to establish a sense of trust and the therapeutic alliance with the patient, so as to ensure a productive counseling session. And the counselor can be uses several techniques to enhance the process of learning, and these are the mainly start the instruction in a positive manner. While you are start your counseling to a individual, to a particular patient, first you have to start your instruction in a positive manner. Okay, माने आपण जितेबेले भी ड्यूरिंग योर काउंसलिंग आपण सबुबेले जो भी केसेस को काउंसलिंग करू सब पॉजिटिव ये रो आपण स्टार्ट करिवे. प्रथम जो डायबिटिक पेशेंट को हमें काउंसलिंग करछन एटा सब तक होइबिटी आपण को पाई एटा एमिति काउंसलिंग करबे ना हम सब पॉजिटिविटी पेशेंट को दबा या कि सर मैडम ये खाइ परबिनी से खाइ परबिनी से करे ना ना आपण सब खाइ परिबे बट इन मॉडरेट आपण का वे ऑफ अप्रोच टू दैट पर्टिकुलर पेशेंट जेमते कि आपण को प्रति तरह गोटे फेथ आसीबो एंड व्हाट यू हैव काउंसल दैट पेशेंट ना दैट पेशेंट शुड बी satisfied with your counseling, then only she or he will follow your guidelines, otherwise he will never follow whatever you are guide to that patient. Understood now what I want to say? बुझी परछन हम कोन कहू छी?
Yes ma'am.
केबे भी डायरेक्ट ए से खाइनी से सब जिंस हम एट टाइम हम सब जगह ता मुंडरे लदी देबानी कि थापी देबानी ताको हमें एमिति वे रे प्रॉपर वे रे ताको कहबा ना आपण नै परिबे. काली काली भी मो से सेंटर बाहर पर्टिकुलर आई विल नॉट मेंशन द नेम ऑफ एनी कहार नाम कहबिनी बट मते पचले मैं मो डायबिटिक मेटा खाइ परिबे कि सेटा एटा शुगर फ्री से तो मैं डायरेक्टली केबे कहा को मना रिफ्यूज करिबानी बट आपण को न्यूट्रिशनली माने आपण को जोटा ठीक आपण जेतु पाठ पढि चंती जोटा ठीक हम ताको मॉडिफाई करि कि मॉडिफाई हमरो वे ऑफ अप्रोचिंग द इमिडिएटली के अदर हवा दरकार जे कि पेशेंट को ताको सुहा उठो सब बडे व्हाइल वी आर काउंसलिंग ना वी शुड फोकस अपॉन द पेशेंट फर्स्ट सेट नंबर फर्स्ट मोटो. Otherwise, whatever we will be counseling, there is no value. Because जदि unless until हमें जहाँ कोचिंग से हम कथा को accept न कला, then हमारे कौन लाभ हम इसका कोई? Yes or no?
Yes
Yes,
ma'am.
ma'am.
And second point is clarify the goals at the beginning of the session also, and the goals कौन अच्छी? Because after the findings, after we go through the files or the different types of that pathological investigation, आपण जानि परिबे जे कोन ताको नीति accordingly you have to guide the patient or guide the individual also. Approach the patient in a competent and quietly enthusiastic manner. It's very important. And keep the session patient centered. बुझी पाले ना नै सेठी आपण आपणकर एटा को सेठी ताको देखिबे नै and focus on the topic to be covered also. And find out if the client understand what he is being told and give the honest sincere praise for the successes. And during the group counseling रे मध्ये आपण माने निहात रूपे group counseling के भी provided by the formal classroom session or a small group session also. And active participation of the group members facilitate the process of learning. And आपण सबुबले जितबे हम ग्रुप फोरम को जाई किछि काउंसलिंग करछंती या किछि लोकन को हम किछि कहउछंती से समय रे मते बहुत इंपोर्टेंट जे आमे हमर सब जिंस तांको पर लॉजिक लगी दबाने तांको टू भी किछि आमे आनिके तांको सुहाइला बेले आमे तांको किछि कहबा ताहाले ही से माने आपण कथा को एक्सेप्ट करिवे ओके एंड दैट टाइम आल्सो यू हैव टू आपण माने ए सब जिंस को तांकर साइकोलॉजिकल फैक्टर्स एंड फिजियोलॉजिकल फैक्टर्स फिजिकल फैक्टर्स पर्सनल फैक्टर्स काउंसलर्स रिलेटेड फैक्टर्स ए सब दिगो को हमें चिंता करबा निहाती दरकार इन द साइकोलॉजिकल फैक्टर बोले की से डिप्रेशन रे थाई पारंती की बा व्यक्तिकर एंजाइटी भी थाए तो सेमान को सुहाइला बळिया ही हमें तांको काउंसलिंग करबा निहाती दरकार Now I will discuss about the adaptation of the therapeutic diet. What is the adaptation of the therapeutic diet? There are different types of dietary adaptation for the therapeutic diet. Mainly, first one is the therapeutic diet and diet prescription, constructing the therapeutic diet and the routine hospital diets. In the hospital, there are different types of diets that are using, like the general diets, normal diets, liquid diets, soft diet, semi-solid diet, oral feeding. In the modes of feeding, there are also different types of mode of feeding, like the oral feeding, tube feeding, or the enteral feeding, peripheral, or the vein feeding. Otherwise, the TPN formula or total parenteral nutrition formula. What is therapeutic diet? If you therapeutic diet, I already discussed about the therapeutic diet. What do you mean by therapeutic diet? What do you mean by therapeutic diet? Therapy is the mode of treatment. Diet is the diet required for the proper particular management of particular disorder, that is called as the therapeutic diet. Good evening. जते न खाई थी बिसी के कौन आने में खाई छी therapeutic diet therapy करी दो सारी दो मैडम therapeutic diet is the adaptation of the normal or the regular diet adaptation of the normal or the regular diet, it is called as the therapeutic diet. The diet for the patient suffering from the different type of disorder. If the patient will be suffer by the heart disease, otherwise hypertension or renal failure or the diabetic, that type of diet is called as the therapeutic diet. What is the purpose of your therapeutic diet? The main purpose of the therapeutic diet is the रही जीवन एटा पपड़ी में होई बानी छी फुल कर देबे A therapeutic diet is the qualitative and the quantitative modified version of the basic nutritious diet, and which has been tailored to suit the changing nutritional needs of a patient or the disease condition. Mainly the regular diet is otherwise called as your normal diet. अपन माने जोटा घरे नउचंती, and that diet may be modified for one or more of the following reasons. Kahin ke hum diet ko modify kariba? Because amaro depending upon the severity of the patient, depending upon the condition of the patient, and depending upon the disorder, accordingly we will be formulate the diet plan, and mainly to maintain or restore the optimum nutritional status and to provide the rest or relief an affected organ. Means if someone will be affected by the typhoid disorder, In the typhoid, what will happen in the typhoid case? Na, the pair patches of EO, GI tract, gastrointestinal tract, pair patches is there. That pair patches is highly inflamed. Due to that only, if we give some irritant or corrosive diet, na, it will increase the disorder. That's why in that dessert now we have to formulate the soft diet or the semi-solid diet or the liquid diet. And mainly specifically for the management of any kind of gastro-related disorder, we are formulate the diet like the soft diet or the liquid diet. Okay. And to adjust to the body ability to digest, to absorb, to metabolize, or to excrete, a low-fat diet for the fat absorption. Those who are having the problem of the any kind of liver disorder or any kind of fat restricted disorder, in that case now you have to include sometimes a low fat diet, because if you will increase the fat content, that then the condition of the patient will be very serious. That's why we have to restrict the what fat, and in that case you have to formulate the low fat diet for the fat malabsorption syndrome. And to adjust to tolerance of the food intake by the mouth, that means if someone will be affected by the oral cancer, okay, those who are having the problem of the oral carcinoma, they cannot take the food through the orally. For in that particular case, we have to formulate the diet like the tube feeding for that patient, and tube feeding, okay, and which if someone will be affected by the some that esophageal cancer, in that case also we have to formulate the what tube feeding. Mainly depending upon the condition of the patient, accordingly we will be formulate the diet plan. Okay, and to adjust the mechanical difficulties, if someone is having the any kind of dental deformity or dental cancer is there, in that case we have to change the diet pattern. In that case we can provide the soft diet or any kind of parental nutrition. And to increase or decrease the body weight, body composition, we have to formulate the either that maybe if those who are having the very low body weight, in that case we have to formulate the high calorie diet, and those who are having the obesity or any kind of that high body weight, in that case we have to recommend the low calorie diet. ଏତିକି ପର୍ଯ୍ୟନ୍ତ ବୁଝି ହେଲା?
Yes, ma'am.
Yes, ma'am.
যদি ଯାହାକୁ ନ ବୁଝୁଛି ଯୋଉଠି ମତେ ସେଇଠି ଷ୍ଟପ୍ କରିବି, ମତେ ସେଇଠି ପୁଣି ଆଉଥରେ କ୍ୱେଶ୍ଚିନ୍ କରିବେ, ତାପରେ ଯାଇକି ମୁଁ ଆଗକୁ ଯିବି। ଏମିତି ମୁଁ ଖାଲି ପଢ଼େଇ ଯିବିନି, ଆପଣମାନେ ଖାଲି ଶୁଣି ଯିବେନି, ସେମିତି ନାହିଁ। ଆପଣ ନ ବୁଝିବେ ଯଦି ମୁଁ ସେଇଠି ବ୍ରେକ୍ କରିବି, ତାପରେ ବୁଝିଲା ପରେ ଆଗକୁ କରିବି। And now I will discuss about the types of the dietary adaptation for the therapeutic needs. ମୁଁ କହିଲି ଯେତେବେଳେ ପେସେଣ୍ଟର ଡିପେଣ୍ଡିଂ ଅପନ୍ ଦ ସିଭିୟରିଟି ଅଫ୍ ଦ ପେସେଣ୍ଟ ଆଣ୍ଡ ଦ କଣ୍ଡିସନ୍ ଅଫ୍ ଦ ପେସେଣ୍ଟ, ଆମେ ସେଇ ଅନୁସାରେ ଆମେ ପେସେଣ୍ଟର ଡାଏଟ୍କୁ ଫର୍ମୁଲେଟ୍ କରିବା ୟା ରେକମେଣ୍ଡ କରିବା। Mainly in the normal nutrition is the very foundation upon which the therapeutic modification are based. Okay. While we are adaptation of the normal diet to suit the therapeutic needs may take the following forms. That means mainly the change in the consistency of the food. आमे যদি नॉर्मल डाइट जहाँ भी हमें डाइट दौचे ना सब हूँ नॉर्मल डाइट रो मॉडिफिकेशन। तो चेंज इन द कंसिस्टेंसी ऑफ द फूड दैट मे बी इन द लिक्विड फॉर्म, दैट इज द लिक्विड डाइट, सॉफ्ट डाइट, लो फाइबर डाइट, हाई फाइबर डाइट. Increase or decrease in the energy value of the diet, such as the low calorie diet for the weight reduction, high calorie diet for the burns. Okay, if someone will be having the first degree burn or the second degree burn or third degree burn or fourth degree burn, in burn case now muscle wasting will be very rapidly increases and weight reduction is very common in that cases, and protein requirement will be increases. For that case now you have to formulate the diet like the high calorie diet for that burn case only. And those who are having the obesity, for that type of patient we have to formulate the low weight reduction diet. And increase or the decrease in the specific nutrient or the type of food consumed, such as the sodium restricted diet. Mainly the sodium restricted diet is implemented for the dropsy patient or for the those who are having the hypertension. In that case also we have to formulate the sodium restricted diet. And those who are having the problem of the ascites also, in that case also you have to formulate the sodium restricted diet. Lactose restricted diet. If those who are having the lactose intolerance cases, so you have to formulate the lactose restricted diet. And high fiber diet, those who are having the constipation or any kind of GI problem, na, in that case also we have to formulate the high fiber diet. High potassium diet, if in some cases potassium requirement will be increases, in that case we have to formulate the high potassium diet. Elimination of spices and condiments is the bland diet. For those who are having the complication of the gastrointestinal disorder or APD, acid peptic disorder, in that case you have to formulate the bland diet, जोटा कि सिझा खाद्य बोली कहा जाए. And omission of specific foods such as the allergic diet, that is the gluten free diet. Gluten free diet, gluten means the gluten माने कौन? Gluten होची गोटे protein. That protein is mainly present in the that wheat रे थाए, barley रे थाए, rye रे थाए, and सबुतक protein sources रे हमरो ये gluten टे थाए. Specifically बहुत सारे cases रे हमरो gluten free diet दिया जाए, because if we will administrate that gluten rich diet, then that condition will be very severe and the allergic syndrome will be increases. Due to that only you have to restrict the gluten rich diet for that particular patient. Okay. And adjustment in the ratio and the balance of the proteins very vital. Fats and carbohydrates such as the diabetic diet, ketogenic diet, renal diet, and cholesterol lowering diet. These are the different types of diet. In some cases, we have to formulate, while we are formulating the diet plan for the any kind of specific categories of patient, na, we have to include some type. In some cases, we have to include the high carb diet. In some cases, we have to reduce the protein content, like the nephrological disorder. In some cases, we are lowering the cholesterol level. But in some cases, we have to increase the cholesterol level. We are adding some cholesterol-rich diet also. Okay. Depending upon the severity of the patient and the condition of the patient, we have to formulate the different types of diet. Thank you, madam. हाँ, ठीक है. Rearrangement of the number and frequency. Rearrangement of the number and frequency of the meals such as the diabetic diet, post gastrectomy diet, diet for the peptic ulcer disorder. Okay. जो disorder थिबा accordingly we will be plan the diet. Plan से specific disorder को लेके हमें सेवन से diet दे पाते हैं. पोस्ट गैस्ट्रोक्टोमी जदि कोनोसी प्रकार गैस्ट्रो सर्जरी हेची तो सेही पोस्ट सर्जरी रे हमें सेही अकॉर्डिंगली हमें ता लैब इन्वेस्टिगेशन को देखि कि ता कंडीशन को देखि भी हमें सेही डाइट फॉर्मुलेट करिबा. ओके. But changing in the feeding intervals and the meal frequency, it's also very vital, because देखो जितबले हमें जो मानकर एंट्रल फीडिंग माने ट्यूब फीडिंग चली थाए किबा जो मानकर नाजोगेस्ट्रिक पाइप रे जो फीडिंग चली थाए से माने को केटर रे आपण माने देखि दिबे के बेले बेले we are providing 100 ml third hourly. If the body will be respond 100 ml third hourly, then gradually we will increase the what means that volume of the diet. That means in the next day of that patient we will start the 200 ml second hourly. If the 200 ml second hourly, the body will be take very properly and the person will be tolerated that amount also. In the next day we will be formulate the 300 ml second hourly. Gradually we will be increase or decreasing the what amount of that ml of the diet depending upon the condition and the severity of the patient. बुझियो जी कौन कहली मु?
यस मैम. हम ग्लाइसेमिक इंडेक्स का कोले रिपीट करबी कि ना?
हाँ, ग्लाइसेमिक इंडेक्स हमें जहाँ भी खाद्य खाऊचंती बुझी ना, जो भी खाद्य हमें खाऊचंती सब थीरे ही जदि माने करो कौन से जिनस हमर नाही जो जिनस के खाइले टिके भी माने सेते कार्ब न थाए. सब जिनस रे किछ ने किछ कार्बोहाइड्रेट थाए बहुत जिनस रे. तो जो कार्बोहाइड्रेट थाए से जो कार्बोहाइड्रेट प्रत्येक फूड रे गोटे ग्लाइसेमिक इंडेक्स थाए. जेमति कि माने करो चीनी कथा हमें चिंता करिबा, गुड़ कथा हमें चिंता करिबा, एवं सेम टाइम जदि हमें करिबा कलरा कथा किबा मेथी साग कथा चिंता करिबा किबा प्लेन मेथी कथा चिंता करिबा, तो ऑब्वियसली आपनकर जोटा खाइला परे बॉडी रे ग्लूकोज लेवल इंस्टेंटली राइज करू, इंस्टेंटली बॉडी जाउ. विथ अ फ्रैक्शन ऑफ सेकंड योर ब्लड ग्लूकोज लेवल विल बी इंक्रीजेस. दैट टाइप्स ऑफ फूड इज कॉल्ड एज द हाई ग्लाइसेमिक डाइट. बुझिएला?
यस मैम.
And if your glycemic level, if your blood glycemic level will be increases, it automatically increase your blood glucose level. Understood? That's why for the diabetic patient, while you are formulating the any kind of diet for the diabetic patient, na, first we have to consider about the glycemic index of that particular diet. Every time we have to, while formulating any kind of diet, we have to formulate the low glycemic index diet. That's very good for the diabetic patient because it will reduce your blood glucose level. बुझिए लगे व्हाट इज ग्लाइसेमिक इंडेक्स? प्रत्येक खाद्यर ग्लाइसेमिक इंडेक्स थाए जो लो हाई ग्लाइसेमिक इंडेक्स मींस एया बुझिबा जो फूड को खाइले इंस्टेंटली ब्लड रे ग्लूकोज लेवल बढ़िबो ताको बुझिबो कोन हमर हाई ग्लाइसेमिक इंडेक्स। बस जेमति कि पाचिला कदली हो सप्ता हो पाचिला आंबो हो যদি আমি গোটে পেশেন্ট কো কি নরমালি আমি যেতলে আমি খাইবা সেটা ইনস্ট্যান্টলি ইট উইল ইনক্রিজ দ্য ব্লাড গ্লাইসেমিক index. That's why our blood glucose level will be increases. That type of diet is called as the high glycemic level diet, high glycemic index value diet. Understood?
Yes, ma'am.
Normal nutrition the base of the therapeutic diet. ମୁଁ କହିଥିଲି ଆପଣମାନଙ୍କୁ ସେଇ କଥା normal diet ର modification ହେଉଛି ଆମର ଏ ସବୁ other diet. Now I will discuss about the diet prescription. Diet prescription is also very important for the dietitian, for the nutritionist, for the clinical practitioners, for the everybody. Diet prescription. What is diet prescription? ଯେମିତି medical prescription, just like that. ଯେତେବେଳେ ଗୋଟେ dietitian ପାଖକୁ ଗୋଟେ patient ଆସୁଛନ୍ତି ଆମେ କଣ ଲେଖୁଛନ୍ତି ଗୋଟେ prescription ଲେଖୁଛନ୍ତି ଦଉଛୁ କହୁଛନ୍ତି ମ୍ୟାମ୍ ଗୋଟେ ଚାର୍ଟ ଦିଅନ୍ତୁ ଆମେ ସେ ଚାର୍ଟ ବି ଏକି ଫଲୋ କରିବୁ ତ that is called as your diet prescription. What is the diet prescription? Mainly the diet prescription designate the type, amounts and the frequency of the feeding based on the an individual disease process and the disease management goals. ଯାହାର ଯାହା ହେଇଥିବ ମନେକର ଗୋଟେ ପେସେଣ୍ଟ ଆସିଛି ତାର ରାଇଜ ଟ୍ୟୁବ୍ ଫିଟିଂ ଚାଲିଛି ତାର ନାଜୋଗାଷ୍ଟ୍ରିକ୍ ଟ୍ୟୁବ୍ ନାଜଲ ଥ୍ରୁ ନୋଜରେ ସେ ତାର ମାନେ ନାଜୋଗାଷ୍ଟ୍ରିକ୍ ଟ୍ୟୁବ୍ ମାଧ୍ୟମରେ ସେ ଫିଡିଂ ନେଉଛି ଏଣ୍ଡ ତାକୁ ଡକ୍ଟର ଲେଖିଛନ୍ତି ପ୍ରତ୍ୟେକ 200 ml ଫିଡିଂ ସେକେଣ୍ଡ ଆୱାରଲି पर डे 8टा ଫିଡିଂ ଦିଯିବ ତ ଆମେ ଆଜି ଡାଇଟିशियन ଆମେ कोन करबा ଆମେ ପ୍ରଥମେ ଲେଖିବା ପେସେଣ୍ଟ ର ନା कोन एज कोन सेक्स कोन बॉडी रो वेट कोन हाइट कोन डिटेल्स हम लिखिले आफ्टर दैट टाइप्स ऑफ डाइट যদি মনে कर 200 ml सेकंड वाली अच्छी डाइट तो हमें सेटा को भी लिखिबा देन हमें ता ऊपर हम लिखिबा whether the patient is normal or any abnormal. That means if the patient is having the any kind of diabetic or non-diabetic. If the patient is having the diabetic, now you have to write down there the diabetic normal liquid 200 ml second hour. बुझी पारिले आपण कोन कहूची?
Yes, ma'am.
ना कष्ट होची बुझियोनी बोते
Ma'am, बुझी होची ma'am.
ओके तो जो डायबिटिक डाइट 200 ml सेकंड वाली जो हमें लिखिबा तो सही अनुसार हमें डाइट प्रिस्क्रिप्शन रे हमें जो 200 ml लिक्विड हमें दबा पेशेंट को कौन 200 ml जो फॉर्मुलेशन हमें लिखिबा से कौन हमें इंग्रेडिएंट्स इंक्लूड करबा फास्ट फीडिंग रे कौन रखिबा नेक्स्ट 2 आवर्स पर कौन फीडिंग दबा नेक्स्ट 2 आवर्स पर फीडिंग कौन देबा एटा होची मो लिक्विड डाइट रो होची if we will formulate a diet plan for the any kind of CKD patient, chronic kidney disease patient, in that case you have to formulate in the early morning what we have to provide, in the mid morning what we have to provide for that CKD patient, and in the evening breakfast also what we have to formulate for that particular type of patient, and in the also lunch what we have to include, and in the evening snacks what we have to include, in the dinner also what we have to include. At last we have to write down the what is the included diet and the excluded diet for the CKD patient. That is all about your diet prescription. Understood?
Yes, ma'am.
You have to formulate. हाँ कौन तो?
हम डाइट प्लान में पोस्ट डिनर किसी दे परिबो हम
बुझी पाली ना उतरे?
मैम जो हमरो अछि ब्रेकफास्ट लंच डिनर तो ଗୋଟେ पोस्ट डिनर रे थाए तो से पोस्ट डिनर को मिल्क रेकमेंडेड की
Yes, milk is recommended for everyone. No restriction, nothing will be there. Okay, unless until जो माने CKD patient, chronic kidney disease patient, those who are having the problem of the ascites. Ascites means देखिथिबे पेट बहुत बड़ हो जाइथिबो सेमानकर ड्यू टू द एनी काइंड ऑफ लिवर टॉक्सिसिटी पाई किबा सिरोसिस ऑफ लिवर पाई जो माने बहुत सारे ड्रिंक करंती सेमानकर लिवर रो इंपेयरमेंट हो जाइता है ड्यू टू दैट ओनली सेमानकर कोन थे एसाइटिस इज योर accumulation of the accumulation of the extra fluid in the intracellular tissue spaces is called as the ascites. In that case also हमें मैंने fluid restriction था अदरवाइज मु कहली क्रॉनिक किडनी डिजीज पेशेंट जो माने किडनी रो कौन सी प्रॉब्लम था तकर बॉडी फिल्ट्रेशन ऊपर एटा अफेक्ट करे दैट्स व्हाई इन दैट केस यू हैव टू रेस्ट्रिक्ट द पोस्ट डिनर रे आपण लिक्विड देबे कि न देबे दैट इज डिपेंड अपॉन यू हैव टू कैलकुलेट डॉक्टर से मेंशन करिथिबे थ्रू आउट द डे यू हैव टू टेक 500 ml of water or 600 ml of water or 800 ml of water whatever you are giving to the patient now throughout the day you have to finish within that level only don't you have to exceed that 800 ml more than 800 ml understand what I want to say
Yes,
and
ma'am.
in the CAD patient also those who are having the case of the cardiovascular disorder in that case also you have to what restrict the fluid otherwise unless and until any deformity is not there na to आराम से अपन पोस्ट डिनर रे समस्त को ही हमें निहात रूपे किछ ना किछ देबा and for the diabetic patient post dinner is more important than that of the dinner also according to my view because मोर जति की माने एटा मो बुक रे लिखा है नी बट मो एक्सपीरियंस मो हॉस्पिटल एक्सपोजर जति की मु जा पेशेंट को देखी छी तो मु कहिबी त निहाती पोस्ट डिनर इज वेरी वाइटल बिकॉज जिते बेले भी जो पेशेंट भी देखी छी those who are having the problem of that diabetic now they are coming in the very late night and they at that time they are suffering by the hypoglycemia and you remember one thing that hypoglycemia is more dangerous than that of your hyperglycemia because hypoglycemia leads to diabetic coma understood and hypoglycemia when occur when your dietary insufficiency is there आपनकर जदि पेशेंट रे जति की कैलोरी नीड अछि सेति की कैलोरी जदि हमें फूड देई नांती in that case only the patient may be suffered by the hypoglycemia because the patient is dependent upon the hypoglycemic drugs he is taking otherwise the patient is dependent upon for the management of their diabetic they are taking the insulin like that na due to that only there may be the chance of hypoglycemia and that due to the hypoglycemia it may leads to diabetic coma in that case patient survival is very difficult okay so Jismita are you got your answer
Yes, ma'am. Yes, ma'am.
understood what I am saying
Yes, ma'am.
आगु को बढ़िबा एबे
Again, ma'am.
so in your diet prescription you have to first you have to in diet prescription designate the types and amount okay and frequency of the feeding based on an individual's disease process and the disease management goals also and the disease may require a calorie level or other restriction to be implemented and it may be also limit or increase the various component of the diet such as the minerals vitamins fat carb protein fiber phytonutrient and water also okay and another aspect with the dietetic prescription mainly takes it into account includes the economic status very vital point while you are writing any diet prescription now you have to first check the economic status of that patient is very important and food habits also such as the whether the patient is having the vegetarian or the ovo vegetarian or non vegetarian and food intolerance it's also very vital because somebody may be affected by the lactose intolerance or the gluten sensitivity also and also they are having the enteropathy complication and as a dietitian you have to ask the patient first about the food allergy that maybe they are having the allergy of the eggs or brinjal or milk also and occupation of the patient and the meal timing also these all are the very vital while you are writing any kind of diet in your prescription and economic status is also very important food habits is also very important I already discussed about this food intolerance like the someone is having the problem of the if someone is having the diarrhea, na, in that case you have to restrict to take that milk product or any kind of dairy product. But cod is included in the diet, specifically milk, and that chenna is completely prohibited. And in allergy case also, you have to consider about the allergy, what type of food allergy is having that patient, and accordingly you have to formulate the menu plan or the diet. Okay. This is all about your what? Diet restriction. And it's very important for you as the energy allowances. Energy allowances means what? Ame while being a dietitian, ame jitebole gote patient ko ame देखुचंती तो ame first देखिबा दरकार जे तार height कोन तार weight कोन patient रो किछि pathophysiological condition कोन patient को कोन हेछि and patient रो कोन need केते कैलोरी आमे पेशेंट को दबा दैट्स वेरी 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 वाइटल जेतिकी कैलोरी गोटे डायबिटिक पेशेंट को दरकार सेतिकी कैलोरी गोटे पीएम पेशेंट को दरकार नहीं प्रोटीन एनर्जी माल न्यूट्रिशन जार थिबो जेतिकी कैलोरी आवश्यक सेतिकी कैलोरी हमर गोटे डायबिटिक पेशेंट को आवश्यक नाही अछि की am I audible to everybody?
मैम बुझिए लेनी कौन कर ना
सुना जाउची ठीक से
हाँ मैम
यस मैम
हाँ मु कौन कहली बुझी परले आपण माने कैलोरी जेते बेले हम गोटे पेशेंट को फॉर्मुलेट करूचंती गोटे डायबिटिक पेशेंट को जेतिकी कैलोरी दरकार गोटे पीएम पेशेंट को प्रोटीन एनर्जी मालनरिश पेशेंट जो माने क्वासियोकोर होंतो कि मानसमस होंतो एक केस सेति कैलोरी आवश्यक होइथाय की
मैम अधिक ही से कैलोरी इनटेक
एक्जाक्टली तो आमे प्रथमे जितबले गोटे पेशेंट आम पाख को आसुची आमे तार टोटल हिस्ट्री नेला परे प्रथमे आमे देखिबा केते कैलोरी आमे ताको रिकमेंड करबा टीसीआर इज द टोटल कैलोरी रिक्वायरमेंट ऑफ दैट पर्टिकुलर पेशेंट और ऑफ दैट इंडिविजुअल्स आमे केमती जानिबा केते कैलोरी रिक्वायरमेंट बोली दैट से लोक तो required number of calorie per kg body weight per day केते that is very important okay सेति पई बोली हमर आमे ताको एस्टिमेट करबा जोटे कि हमें कुआ जे हेरिस बेंडिक फार्मूला इन द BEE means it refers to basic energy expenditure from the anthropometric data using the following Harris Bendick formula. Harris Bendick formula means for the men, for the women, the calorie requirement of the men and the calorie requirement of the women is totally different from each other. The calorie requirement of the for the men na हमें ताको calculate करबा like this. तार ओटे formula अछि जेंति कि 66 plus 13.7 into body weight plus 5 into body height minus 6.8 into एज सेटा होची टोटल कैलोरी रिक्वायरमेंट फॉर द मेल सिम्पली फीमेल मानक पई जेते हम देखिबा बेसिक एनर्जी एक्सपेंडिचर हमें प्रथमे 655 प्लस 9.6 इनटू बॉडी वेट प्लस 1.85 इनटू बॉडी हाइट माइनस 4.7 इनटू एज एतिकी करले जेतिकी कैलोरीज आसीबो जेतिकी किलो कैलोरी आसीबो दैट इज द कैलोरी दैट अमाउंट ऑफ कैलोरी इज रिक्वायर्ड फॉर दैट पर्टिकुलर टाइप ऑफ इंडिविजुअल बुझिए ना एतिकी एटा मने रखिया को पड़बा अपन को निजे
यस मैम बुझिए मैम
बस एथरे अपन कैलकुलेट करबे देन तापरे हमें जानि के टोटल कैलोरी रिक्वायरमेंट केते हां यस
मैम अकॉर्डिंग टू बीएमआई हमें तंको देई परिबा की रिकमेंड कर परिबा की
कौन सुना जाउनी ठीक से
अकॉर्डिंग टू बीएमआई मैम बॉडी मास इंडेक्स
नो 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 बीएमआई आंसर है नहीं नॉर्मली तो हमें जितबळे माने हमें माने पूरा रेगुलर बेसिस पे हम प्रैक्टिस से पढ़े आसीबा नॉर्मली हमें 20 रो 25 किलो कैलोरी पर केजी बॉडी वेट हमें दियंती कहा को एडल्ट मानो एडल्ट बुझियला 25 किलो कैलोरी पर केजी बॉडी वेट दैट मींस जोति मनिकर मोर बॉडी वेट अछि जोति स्टैंडर्ड बॉडी वेट बुझियछि ना नहीं जोति हमर बॉडी रो वेट स्टैंडर्ड बॉडी वेट का को कहबा आमे प्रथमे बॉडी रो हाइट देखिबा हाइट केते सेंटीमीटर अछि मनिकर 130 सेंटीमीटर हाइट अछि ताले मोर बॉडी वेट केते होबा दरकार 130 सेंटीमीटर जति बॉडी रो हाइट अछि बॉडी वेट केते होबा दरकार ताले हम कहबो स्टैंडर्ड बॉडी वेट केते हिथिले एबे या पूर्वर मु बुझेइथिली ना ए पूर्वर ही मु पढेइथिली सब हाँ हम ताको -100 करिता
माइनस
सब मन रखो इट्स वेरी सिंपल बीइंग ए न्यूट्रिशनिस्ट आम जेहेतु न्यूट्रिशनल साइंस सहित जड़ित एगुड़ा सिंपल सिंपल जिनस एंड ईच एंड एवरी स्टेप ऑफ योर लाइफ इट्स वेरी वाइटल अंडरस्टूड ना मैंने एमती नुह जे मैडम आज कहते मुझे आज क्लास शुणी लेकिन परीक्षा लिखिदेवी मार्क्स सिक्योर करते काली सकाळ मो लाइफ दरकार बिल्कुल सेम इट्स वेरी 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 वाइटल फॉर ईच एंड एवरी स्टेप ऑफ योर लाइफ तो मु कहबा कथा प्रथमे आपण माने आपनकर बॉडी रो हाइट को सेंटीमीटर रे कन्वर्ट करंतो जदि मोर बॉडी हाइट 130 सेंटीमीटर अछि सेइथिरो मु माइनस जदि फर्स्ट थिंग हला बीएमआई को देखिबे नॉर्मल अछि कि एबनॉर्मल बीएमआई केमती कैलकुलेट करिवार मु जस्ट क्लास रे कहि आज भी कहिछि तो तापरे आमे देखिबा बॉडी रो वेट हाइट होछि जेतिकी थिबो सेथिरो में -100 करिबा माने कि मोर बॉडी रो वेट अछि केते हाइट अछि 130 सेंटीमीटर -30 -100 केते ला 30 दैट मींस मोर जति बॉडी वेट जति 30 केजी थिबो ताले मोर स्टैंडर्ड बॉडी वेट बुझिएला कोन कहिली
आगे मैम
बॉडी रो हाइट को सेंटीमीटर रे कन्वर्ट कला परे ताको -100 कला परे जेति के आसीबो सेटा होछि तमर स्टैंडर्ड बॉडी वेट तो सेही स्टैंडर्ड बॉडी वेट हमें जिते बेले हमें कैलकुलेट करछन कैलोरी रिक्वायरमेंट कैलकुलेट कला नॉर्मली फॉर द एडल्ट मानक पई मु कहूची एडल्ट पई 20 टू 25 किलो कैलोरी या 25 किलो कैलोरी इज स्टैंडर्ड फॉर द एडल्ट दैट मींस माने मोर बॉडी रो वेट अछि 42 सॉरी 42 into 25 कैलकुलेट करिवे केते जेति के आसीबो सेति के होची योर टोटल कैलोरी रिक्वायरमेंट ऑफ दैट पर्टिकुलर इंडिविजुअल्स गोटे दिन रे ताको सेति की किलो कैलोरी रो खाद्य ताको दरकार ऑल ऑफ यू क्लियर अबाउट दैट नाउ केंति बुझेबी
मैम बुझिए मैम
बुझी हेलानी ना बुझी हेला
मैम बुझिए
हेला
आगे मैम
ओके तापरे आमे जानिले जे मनेकर मोर पर डे कैलोरी रिक्वायरमेंट होची मनेकर 1800 किलो कैलोरी मोर आसिला तो सेही जो 1800 किलो करे 1800 किलो कैलोरी को हमें थ्रू आउट द डे रे ताको सेग्रीगेट करिबा ताको हमें डिवाइड करिबा ऑल ऑफ यू क्लियर
यस मैम
फर्स्ट थिंग है हमर तीनटा मेजर्स मील्स रखिबा और दीटा इंटरमीडिएट फीड रखिबा तीनटा मेजर्स मील्स रे फर्स्ट वन इज ब्रेकफास्ट लंच एंड डिनर in between the breakfast lunch and dinner you have to include that 3 what intermediate feed means in between the meals you have to include the some short meals like that either that may be tender coconut water otherwise that buttermilk otherwise any kind of soup juice dal water otherwise you can include the any kind of fruit salads or whole fruits also otherwise fruit juice also otherwise you can include the chatua whatever you like you have to include in between the two major meals you have to केबे भी हमें पेशेंट को एनी इंडिविजुअल्स को केबे भी रेकमेंड करिबानी 3 आवर्स परे आ भूकिला रहबा पई ई 3 आवर्स 3 टू 3.5 घंटा परे किछि ना किछि मु माने एमिति कोन कि खाली यू हैव टू टेक दैट कुक फूड रंधा वाला खाद्य ही आपण खाइबे सेटा नो इन बिटवीन द एनी टू मेजर्स मील्स यू कैन टेक दैट juice also you can take that coconut water also you can take that LGS lime juice with honey also you can take that one cucumber also or otherwise any whole fruits like whatever you like you can take at that time understood
यस मैम
and जेतेबेले हमें फॉर्मुलेट करूछंती मेनू प्लान तो हमें सेही थ्रू जो हमें 1800 किलो कैलोरी जति मते गोटे दिन रे डाइट दरकार तो से 1800 किलो कैलोरी हमें अगेन वी हैव टू डिवाइड segregate the whole calorie into हमें कार्ब केते नबा प्रोटीन केते नबा फैट केते नबा एटा तो मेजर ना तो ए तीनटा जिंस को अगेन हमें ताको सेग्रीगेट करिबा बुझियला तो carbohydrate mainly provides the bulk to the diet and along with the fats also and carbohydrate is the chief source of calories and carbohydrate in high calories diet that mainly includes the all types of biscuit that rice and chapati bread all these things is contain the carb only and in a low carb diet this must be used sparingly protein प्रोटीन स्पेसिफिकली आगुरी हमर रेकमेंडेड थिला हमें माने 0.8 टू 1 ग्राम 0.8 टू 1 ग्राम 1 ग्राम केजी पर बॉडी वेट हमें रेकमेंड करथले बट नाउ हमें एबे जो आईसीएमआर जो आसी जो लेटेस्ट हमको guidelines अछि according to that guidelines for the each and every person 1.2 to 1.5 per kg 1.2 to 1.5 grams per kg body weight protein is required for the healthy life but in some pathological condition physiological condition it may be increases or it may be decreases depending upon the severity and the condition of the patients. Okay, like a larger amount of protein may be needed during the severe protein wasting, such as the those who are having the enteropathy. Enteropathy means that enteropathy was one type of complication with the liver disorder पढ़े हुए से समय कोई भी और extensive drainage from the wounds and fistula. जितबले देखी थी भी जितबले ज़्यादा से ज़्यादा muscles wasting हो तो किंबा bonds केस थे जो कोड़ी जाए थे जो wound है ताई otherwise any kinds of non healing wound जो wound है किंबा and that will be not recover very easily in that case also you have to increase the protein content and protein restriction may be needed in the acute renal failure or hepatic insufficiency. Those who are having the problem with any kind of liver disorder जो माने को liver रे कौन सी समस्या रही किंबा those who are having the problem with any kind of renal failure that means kidney disorder in these two cases you have to restrict the protein but otherwise you can increase the protein content okay and एंड जो माने को जदी प्रोटीन कंटेंट ज्यादा दरकार थिबो तो आमे से मान को निहाती रूपे पर डे आमे निहाती रूपे 800 ml पर्यंत मिल्क पर वन डे रे आमे रेकमेंड करि परिबा and other sources of protein maybe you can include the yogurt also ice cream also chocolates also coffee also and milk and dairy product cheese sauce eggs all these are the very good sources of protein you can include in that also and the protein mainly patient and the protein restricted or the low protein diet mainly includes the one with the portal systemic encephalopathy. I already told you in that encephalopathy patient you have to restrict the protein and CRF. Those are having the chronic CRF is nothing. CRF is your chronic renal failure. जो माने कर kidney failure आड़ को जाओ तो but those who are having not able to kidney যদি properly function होनी properly filtration होनी in that case you have to restrict the protein you cannot give them 1.5 or 1.2 gram per kg body weight protein like that you have to reduce the protein content in that particular cases only understood and the diet is mainly based upon the daily allowances of the protein foods with the emphasis on the high class of protein and a few examples of the low protein foods may be included in the diet those जो जो मन को हाई प्रोटीन फैस्टस प्रोटीन जो मन को प्रोहिबिट है जो मन को रेस्ट्रिक्शन है in that case you can include the carrots cabbage mushroom tomato turnips and beetroot also but in CKD patient those who are having the chronic renal failure or any kind of kidney disorder so in that case you cannot include mushroom tomato turnips cabbage and beetroot all these things are completely prohibited for the any kind of kidney disorder बुझिए ना मुझे आप पहुंची
Yes, ma'am.
मु एत्ती समय आपण माने को चारिटा क्लास लेनी मोर एनर्जी लॉस होनी आ तम माने को ये सब नो को एनर्जी कोड पाउनी ना कोन असुविधा कोन होछि बुझुनी जदी पुआ मैडम बुझुनी म आउतरे बुझिएबी किछ असुविधा नै सुनिबारे भी एनर्जी लॉस हो जाए कि सुचिस्मिता राजलक्ष्मी
No, ma'am. Energy ठीक अछि.
निद आसी गलाडी बोले
No,
only
no.
4 minutes left wait for 4 minutes after that you will be completely free okay आज जेतबे एग्जाम आसीबो ना आज जेतबे बही खोलिबो सेतबेल को भाबिबो जे क्लास रो कोन ये थिला बुझिले बे किछि लागिबोनी एबे तो बोर ही लागिबो ठीक कोछि ना भूल कोछि
Yes, ma'am.
Okay, now I will discuss about the fats. Fats is also very important for the while formulating the any type of diet plans. Now we have not restrict the fat because fat is also play a major role for the management of different types of disorder, and the fat is also the reservoir of the calorie. Also, in addition to the carbohydrate, fat can also be important source of needed calorie. Understood? And therapeutic condition, its fat is highly necessary to prevent the essential fatty acid deficiency. Because ଦେଖିଥିବେ ଯେତେବେଳେ ବି any kind of disorder କିମ୍ବା disease ଆମର fat ର loss ହୁଏ, bodyର weight reduction ହୁଏ, ତ ନିହାତି ରୂପେ fat is also very vital. A high calorie diet should contain the fatty foods such as the cream, butter, ghee or oil, while a low calorie diet does not contain any kinds of ghee or butter or oil or the cream. And mainly specifically while we are formulating the any type of diet, now you have to include that diet very good sources of fat. That good sources of fat is otherwise called as your healthy fats को हमें निहाती रूप से diet include करवा दरकार. Patient may be requiring the low animal fats diet must restrict their total fat consumption to less than 30%. That means हमें specifically हमें fat जो नौचंती हमें animal sources of protein को अधिक emphasize दौचंती, but you have sources of proteins, and specifically 30% or less than 30% of this animal sources of protein is good, and the energy needed, and ideally two-thirds of this must be intake in the form of the PUFA form. PUFA is nothing. PUFA is your polyunsaturated fatty acids, and the MUFA is your monounsaturated fatty acids, and this can be achieved by avoiding the foods that are very rich in the saturated fat acids. Those who are that diet which contains the SFAS, that is the saturated fatty acids, and say the example of the saturated fatty acids is such as the all the fried food and all the junk food, all the processed food, and fish, whole milks, and the fried eggs, also cream, cheese, nuts, peanuts, coconut, chocolates, water. All these are the comes under the SFAS. That is the saturated fatty acid. That saturated fatty acid is not good for your health. Okay. And while food products such as the poultry and white fish, egg white, cottage cheese, skim milk, whole milk, cereals, and the fruits, vegetables, whole milk bread, and the plain biscuit and the fatless sponge requires no restriction. In your diet, you have to regular basis. You have to include the healthy kinds of fats. Healthy fats means good fats. Because if in our diet, if you will include the healthy fats or the good types of fats, it will increase your HDL level and that high density lipoprotein. And if your HDL level will be increases, now it will keeps your health heart healthy, and by intake of the healthy fats now it also reduces your LDL level, low density lipoprotein, and it also decrease your cholesterol level, triglycerides level, VLDL level, both very low density lipoprotein also. Okay. And while formulating the diet also, you have to give more emphasis to the minerals and the vitamin content also, because in the minerals and the vitamin content you have to regular basis you have to include the ascorbic acid and the vitamin B complex in your diet. Minerals and zinc is also very important in your diet. While formulating the diet plan, now the sodium and potassium plays is very important role in your diet. In sodium restricted diet, and the foods containing high sodium content must be avoided. And the example of the high sodium content diet are mainly all the cured meat or the processed meat, and the tin and smoke fish also, and the tin vegetable soups, and that dehydrated meals also, salted biscuit, nuts and chips, and they are contains a high amount of sodium, and that is not good for your health. And those who are having the problem of the CKD, chronic kidney disease, or those who are having the problem of the CAD, also coronary artery disease, this type of diet is completely prohibited for them. And potassium, in some cases of the disorder, potassium is also restricted, and potassium restricted diet are also important for the patient with the advanced renal failure undergoing the conservative treatment of the hemodialysis. That means those who are having the problem in the chronic renal failure patient, or those who are having the any kind of kidney disorder, in that cases they are depend upon the dialysis. Understood? Hemodialysis. In that case, you have to completely restrict the potassium. If you will be increase the potassium content in the diet, then it will causes the very harmful effect in the body. And the high potassium food sources, the example of the high potassium diets is mainly all the breakfast cereals, also whole grains. That means ଆମେ ଯେମିତି recommend କରୁଛୁ ମାନେ ନାଲି ଚାଉଳ ଖାଇବ या ଆପଣ ଏଟା ଖାଇବେ କୋଉଟା ମାନେ ମିଲେଟ୍ସ ଖାଇବେ या with the bran जो जिनस खाइबो, that is not indicated for the hemodialysis patient. Those are having the problem of the CKD, na chronic, not CKD, those are having the problem of the chronic renal failure patient. In that case, that type of potassium is not good for their health. Okay, in that case, now you have to restrict the potassium also. The high potassium foods such as the whole grain breakfast cereals, so in vegetables like the beetroot, beans, broccoli, leeks, mushroom, spinach, tomato, dry and split beans, lentils, fruits, prunes, dates, and grapefruits, orange, banana, completely prohibited for those who are having the problem of the CKD, and if they will be depend upon the hemodialysis or any kind of dialysis, the potassium restriction must be there in their diet. The vegetables should not be eaten raw rather than they require the leaching before the consumption. And in for the chronic renal failure patient, you have to recommend the patient to before using any kind of vegetable, they will follow the leaching process. If they will be leach the fruits or vegetable before they are using, they will reduce the potassium content. Understood? And that will also good for their health. And what about the fluid? That fluid also, a fluid diet also given to the patient with more advanced or the dysphagia. That means if someone will be having the problem of the deglutition problem, no, they are not able to deglute the food properly. In that dysphagia, difficult for the swelling. In that case, you can include the fluid diet or the fractured jaws. Usually, having the human fracture lower jaw, upper jaw. In that case, they will be not means chew kari. In that case, you can formulate them the fluid diet. Okay. In this diet, that may mainly include the fruit juices and the stain porridge also. Porridge माने जेकोसी जिनसे को गोटे माने सुजी खीरी हो, सागु खीरी हो, ओट्स खीरी हो या बार्ली खीरी हो कि मांडिया खीरी हो, ताकू करके हम ताकू स्टेन करबे, छानी की ताकू पेशेंट को हमें देगी पाइबा. And in that case you have to include the milk also. Egg in milk, it's a very good diet. Okay, हमें जितना बोला जेकोसी नाजोगेस्ट्रिक ट्यूब हो कि ए जो डिस्फाजिया हो कि जो को फ्लूइड डाइट होचंती तो क्षीर से तो अंडा हमें निहात रूपे ताकू रखिबा फॉर द प्रोटीन कंटेंट को हमें एलिवेट करिया पाई. एंड स्टेन सूप, एनी सूप को हमें स्टेन करके देई परिबा. मिल्क पुडिंग, आइसक्रीम, योगर्ट also very good. And the whole protein or the polymeric liquid feeds may be given also. Okay, and since such diet lack of bulk and can cause the colonic dysfunction, they are available with the fiber supplements. And normally a healthy adult at rest रे हमें ताको 1800 ml to 2500 ml पर्यंत fluid हमें ताको दे परिबा. And in the hospital diet माने हमें तो patient कथा हमें चिंता करछन. In that case 1 ml जो fluid patient को जाउ तबा सेते 1 किलोकैलोरी रो नियाति रूपे न्यूट्रिटिव वैल्यू रहितबे नियाति दरकार. हाँ जिते बेला हमें फ्लूइड अलाउंस हमें केते फ्लूइड हमें दबा गोटे पेशेंट को से समय हमें कोन करबा ना टोटल प्रथम होची 500 ml कंपलसरी रखिबे. ताको ऐड करिबा आपन को थ्रू आउट द 24 आवर्स रे गोटे पेशेंट को केते यूरिन आउटपुट होची. एंड का से तो आपन ऐड करी फ्लूइड लॉस ड्यू टू डायरिया, वोमिटिंग इफ एनी. देखि जेतो हम पेशेंट को सेते पचर केतर आपन को बांती हलानी, केतर झाडा हलानी, तो हमें सही अनुसार हम सस्पेक्ट करि परिबा केते बॉडी का डिहाइड्रेट है. अकॉर्डिंगली वी विल प्लान फॉर द टोटल फ्लूइड allowance. Okay, now the time is 6:05 PM हे गलानी. काली हमें बाकी तक जिनसे डिस्कस करिबा. Okay, आज jau नाही क्लास को हमें सेठी ए करिबा. काली की नेक्स्ट क्लास रे हम जहा पढिबा कथा पढिबा. And अपन माने समझते ही घर को जाए कि जहाँ मैं पढ़ेली पढ़ंतु. And today class is very important. I already discussed about the what is the diet prescription, what is the nutritional assessment, what is SOAP, what is ABCD, and what is medical nutrition therapy. Everything I already discussed about very briefly. तो एटा सब एग्जाम पॉइंट ऑफ व्यू इट्स वेरी वाइटल फॉर यू. दैट्स व्हाई अपन मानन को निहाती पढ़ंतु. न पढ़ले किसी भी हेल्प आमे फील्ड को आछन माने तो स्टडी करबा निहाती दरकार ओके थैंक यू एवरीवन रहिबा एथर हमें
थैंक यू मैम
ओके थैंक यू